welcome everybody back after lunch. It was lovely to see everyone chatting and networking. It was, and we're just a few minutes late, but I think that's great given that we've had an opportunity to all chat. So following on from this morning, we're going to have some further talks and some further presentations in a bit. And the focus, again, thinking about what we heard earlier, is on mental health. So we heard just earlier about the importance and the rising prevalence of mental health, particularly in children and young people, that 1 in 5 young people have now are thought to have diagnosable mental health problems, and that there are certain groups that are at higher risk than others. So there's sex differences, men tend to be less likely to talk about their problems, but there's also certain periods in our life when mental health problems seem to be increased and we're more vulnerable. There's also been a number of policies that have come out to try and support and improve mental health, particularly around children and young people, and also to develop the mental health research and mental health practice workforce as well. There's been a lot of emphasis on how we identify and treat mental health problems early in children, looking at supporting young men during the periods when they're at risk, and thinking about early life and pregnancy, following pregnancy, when there's peak periods when mental health problems increase. So the school has been doing a number of projects that are related to those, and we're going to hear a couple of them today, this afternoon, right now. So I'm going to welcome, first of all, our first group of presenters, which is the 4S study. So Abby and Usman are going to start us off, and I'd like to welcome them to the stage.
Thank you very much. So it's really nice to be here today. Those of you that don't know me, I'm Abby Russell. I'm an Associate Professor in Child and Adolescent Mental Health based at the University of Exeter, and I'm one of the co-leads for the 4S project. And with me today I have Usman Javid, who's going to talk kind of in between the bits that I say in my talk. He's one of our young people partners, so he's going to give you a real flavour of how young people have been involved in the 4S project. So we've got a very long project title, but essentially it's about support systems for self-harm and suicide for young people. So we call it the 4S study. Just a really brief bit of background. Suicide is one of the leading causes of death in 10 to 19-year-olds in the UK. And self-harm is on the rise among teenagers, and it's a really strong risk factor for later attempted or completed suicide. So by age 17, population data tell us that 24% of young people will tell us that they've ever self-harmed, and 7% will say that they've attempted suicide. So it's a really prevalent problem. And there's, I think, quite an obvious potential for schools and colleges to provide better prevention and support for young people in this area. So the overarching aim of the 4S project, which we've been running for a few years now, is to strengthen the support that we provide to education and other youth organisations around the management of self-harm and suicide risk in young people and how they respond when there has been a death by suicide. So I'm going to give you a really whistle-stop overview of the research that we've done in the 4S project. So in phase 1, which we started in 2023, we developed our ideas, we did some stakeholder recruitment, and we scoped what was already out there. So we did a survey of schools, colleges and youth organisations, we conducted a scoping review of current guidance, and we set up our advisory groups, of which Usman is a member. And then in phase 2, which we've nearly finished now, we've been doing more in-depth research, and we're co-producing principles of practice, which I'll tell you about later in the talk. And to do that, we've done interviews and focus groups where we focus particularly on 4 different geographical areas. We've conducted a Delphi study to get consensus, and we're producing these principles. So with the survey that we conducted, we had 115 responses from schools and colleges, and 12 responses, I think, from youth organisations. And the school data told us that a third of these settings didn't actually mention self-harm or suicide specifically in any policy that they had relating to young people. And when they did mention it in a policy, it was often combined within another policy. So, for example, mentioned within safeguarding, but not having a specific standalone policy relating to self-harm or suicide prevention or response. We also saw that the majority of pastoral, so support staff, had training on self-harm and suicide, but only a small percentage of teaching staff actually had training. And that's really important because young people tell us that it's the adult in an organisation that they trust that they will go to. That's not necessarily the designated adult or a pastoral member of staff. So we did look at differences between schools and colleges that didn't have policies around self-harm and suicide. And the settings that did told us that they delivered more prevention, intervention and support activities, and they had a higher proportion of staff trained. So that's some initial evidence that suggests that having a policy that specifically talks about self-harm and suicide might be associated with more activity that could support young people. Then we did a scoping review of self-harm and suicide guidance that was available to education and youth organisations that kind of provide support to young people, and we wanted to identify gaps in this provision. And we found 104 different policy documents that were relevant, with about half of those being targeted at educational settings, kind of most of the other half being about multi-agency settings and applicable to different settings, but only 5 targeted towards youth organisations. And what you can see on the right-hand side here is that the focus of the guidance was often around prevention, some about self-harm, but some about self-harm and suicide, and others about critical incident planning. And then there were fewer policies that covered kind of support after a death or prevention and support after a death. So this paper has been published. The previous one is in peer review at the moment. So moving on to phase 2, we've conducted a qualitative study. So we've done interviews with 34 adults. So those are professionals who work with young people or in organisations that provide support, and education and youth organisation staff. And we've also done interviews and focus groups with a total of 64 young people with lived experience. And we asked them about their experiences of the support that they either provide or they have received in relation to self-harm and suicide. So we followed semi-structured topic guides, and then to do our analysis, we split into 2 teams within the 4S project. So there's quite a lot of us who work on it. And our analysis team included one of our young people partners as well. And we analysed the adults' data and the young people's data separately because they had slightly different topic guides and different experiences. And now that we're writing that up, we're planning 3 different academic papers on this. So one about the points of view from adults, one from young people, and one that really combines those data and focuses on the support that's received after a death by suicide. So as a brief overview of those findings, these are from the adult interviews. What we found was that there was a need to enhance staff capacity, so improving training and ensuring clearer communication and partnerships, both within schools but also between school communities and families. There were also lots of evidence of significant structural and systemic issues, so things like a lack of early intervention strategies or gaps in the curriculum, and perhaps not surprisingly with mental health, a lack of coordination between different agencies. And specific to this topic, I think, quite a reliance on reactive approaches rather than proactive planning. There was also a lack of clarity around roles and responsibilities and thresholds. So staff often said that they felt underprepared or unsupported when they were working with young people. And there was quite a lot of confusion about who was responsible for different aspects of care or intervention. Our 4th theme was about fear, shame and stigma around the topics of self-harm and suicide, and that really hinders prevention and open communication. So schools particularly told us that they were quite reluctant to talk about these issues because they were worried about liability, reputational risk and a possibility of contagion. And then the 5th theme was about the influence of broader cultural and social factors on how young people experience and engage with support. And our participants really emphasised the importance of informal spaces and peer and community support and inclusive approaches. Now, I'm not going to have time to go into the same detail with the other interviews we did, but with young people, our themes were around access and acceptance of support and how hard that can be when you don't know what options are available. The varied adult responses and responsibilities and how that influences young people's experiences of support. just how important confidentiality and privacy is to young people when they're seeking support or disclosing to an adult, and that helpful support always felt relatable and reliable to them. And then with our kind of qualitative findings that looked at both of those, what we saw that there were often predominantly these reactive models, which I've already talked about a bit, but young people talked about that effect as well. And then there was kind of a ripple effect where a suicide affects kind of wider networks across schools, and often schools would just think about the peers who they knew were closest to the young person affected, rather than thinking about others in the setting who needed support that they might not be aware of. There is this perceived avoidance by settings, and that links to the complexity of the response to a death by suicide and the multi-agencies involved in the responses. So we've also done a Delphi study where we took the findings from this and developed a list of statements and asked our professional stakeholders as to which were most important to guide a policy for schools and youth organisations around self-harm and suicide. We've completed that now, and we've had 82 statements that have reached consensus. And I'm going to hand over now to Usman, who's going to talk about his public involvement. Okay.
Hi everyone, I hope you're all doing well. I'm Usman, I'm 21, and I'm a young person who's been part of the advisory group for the 4S study since 2023. Being someone with lived experience of depression and anxiety, I felt that it was important for me to speak up about my experiences. Now more than ever, it's incredibly important to recognise the inequality and discrimination lots of young people face, how different young people experience the school system, the healthcare system, and the criminal justice system very differently. Getting involved in mental health research has opened many doors for me and allowed me to have experiences I never would have dreamed of when I started the YPAG. I found out about the YPAG through the McPin Foundation, a children and young people's mental health research charity. I've worked closely with them since 2022. Now that's all well and good, but what did I actually do? Beginning in October 2023, the work we did was based on shaping the Grey Literature Review. This ensured that the review reflected young people's priorities and highlighted gaps in the guidance that professionals may have overlooked. This improved the clarity and the relevance of the reviews. In March of the next year, we began to co-design the Phase 2 topic guide and co-design the recruitment strategy. As a result, it made the study safer, more accessible, and allowed young people who took part to feel more comfortable and safe. In August of the same year, the work we did reviewing contact processes, topic guide structure, and participation in information sheets allowed for improved understanding and reduced anxiety, more inclusive, accessible wording, and a strengthened ethical handling of sensitive topics. In November, we ensured that the dissemination materials were approachable, youth-friendly, and able to engage young people through a review of the infographics used in the guidance review. And in November of 2025, our work reviewing the findings from young people and prioritising them for schools and youth organisations ensured that the final outputs of the study reflect what young people actually think professionals need to understand. Our YPAG allowed the study to truly have an impact. A study by young people, for young people. Our voices were kept central to the study and shaped its future at every point. It wasn't being told what to do and how to do it. It was being asked how I feel and how I wanted to do it, the way I wanted it to happen. The power was and is in my hands equally, shared with the researchers. It allowed me to understand that my voice isn't just the words I speak, it is the impact I can have on other young people who were just like me. Now I want to talk about the importance of youth co-production, and I want to touch upon the phrase, nothing about us without us, meaning research, policy, and services should actively involve people with lived experience of those issues. This isn't just a nice idea young people have. The right to be heard and taken seriously in decisions that affect them is in the UN Conventions of the Rights of the Child, Article 12. Having a seat at the table to challenge, shape, and influence decision makers directly, rather than being spoken for. Co-production is about the rights young people have, the quality of work produced, and the impact that work has. Now I'll pass over to Abby. Thank you.
Thank you so much, Usman. So to finish off, I'll tell you a bit more about our principles of practice and then our plans for disseminating this, because obviously we don't want to do all of this work and just have it published in academic papers, which, you know, rarely get read, let's face it, by people outside this room. So we've taken those 82 statements from the Delphi study and condensed them down into a format that we think will be digestible for schools and colleges and youth organisations to digest and implement. So in my head, that's kind of if a school is designing a policy specifically about suicide prevention, they'll look at our principles and think, have we covered these things in our policy? So from those 82 statements, we've managed to get it down to, I think, 7 or 8 principles at the moment. They do have bullet points under them. They're not quite as concise as you might hope, but overall the document's only about 3 pages long, which is really important when you're working with busy people with multiple responsibilities. So one of the examples of our overarching principles is all adults should know the process for approaching or responding to a young person that they're concerned about in relation to possible self-harm, suicidal thoughts and or suicidal behaviours. So most of them are about this long, and they have kind of 4 bullet points that say specific things that these settings might want to consider when they're planning actions around that. So in terms of what we're doing next, we're planning to take these draft principles to our PPI groups, and that includes school staff that we've been working with as well, and our partner organisations such as the UK Trauma Council. We're going to finalise these principles, and we're going to produce a video version because that's nice and accessible, and it's a way that a lot of people digest information at the moment. And then we'll be sharing this finalised version via our partners and collaborators, sharing it more widely with the public health and education sector. So we're planning a series of webinars, blogs and podcasts and a policy brief, and then also sharing with the public, and hopefully applying for an Impact Accelerator Award so that we can build a website that has more content to support settings to develop and implement based on these principles. So I'm going to use my last 30 seconds to leave up a slide with a QR code. But if you have links with organisations or networks who might be interested in receiving the principles of practice or being part of that consultation process as we finalise them, we'd really value it as a team if you can kind of scan this QR code and add it to our dissemination list. And as you've seen, we've been working on this since 2023, and we've been building a list of interested people and partners all throughout that time as well. So that's one of the nice things about a long-lasting SPHR project. So hopefully you've had time to scan that. If not, I'm sure the slides will go out. And before the bubbles go off, thanks very much for listening.
Thank you very much, Usman and Abby, for a really interesting, engaging talk. And we're going to go straight on to our next speakers. So we have Will and Ozzy, who are going to talk to us about improving mental health outcomes in disadvantaged men. After they've finished, we can ask questions from both groups. So over to you, Will.
Thank you, and thanks to Usman and Abby for a really great presentation there. So we're going to talk to you a little bit about a project that we've been involved in over the last 2 years, which focuses on young men's mental health and community resource engagement. I'm not going to reiterate too much of this context because I think a lot of this has been covered already, and it's embedded in the focus of this ASM, which is about prevention. But what I do want to say is that community resources are really centre stage at the moment within a lot of the policy priorities around public mental health. So they're there in the emphasis on a shift from the clinic to the community, in the emphasis on treatment to prevention in the NHS 10-year plan. They're at the centre of the National Youth Strategy, which was published at the end of last year. They're embedded in the Men's Health Strategy, and they're also emphasised within the Civil Society Covenant, which was published at the last year, which sets out a promise from the government to improve relationships between statutory agencies and the third sector or civil society organisations more generally. So there's a lot of interest and a lot of potential in the role of community organisations for building the foundations for good mental health, which were in Efra's really beautiful sort of slide of the mental health sort of ecology or community. But the voluntary and community sector is also a site of depletion, where there's been systematic disinvestment, and there's a lot of fantastic work that happens with very limited resources. So what we wanted to do with this project was really understand what it was that community resources can offer for young men's mental health in particular, in order to try and build a more robust evidence base to support the investment in these resources in a way that's sustainable and meaningful for the long term. So we've been involved in 2 strands of work, and this is with a larger team. Some of them are in the room. GJ's here. Give a wave, GJ. Hannah Fairbrother is here. Michelle Tester-Jones is here. And there are also a number of other academics that couldn't make it, but we're speaking, as part of a community here. We're involved in a realist review that looked at the evidence for community resources for young men's mental health, and then 2 collaborative case studies which offered a much deeper dive into what it was that these kinds of organisations are offering for young men in their communities. And it's the Sheffield case study that Ozzy and I have been involved in that we're going to focus on in more detail today. But before we do that, I just want to give you a very quick sort of whistle-stop tour of our evidence review. So this was published very recently. It's hot off the press. Michelle screened over 10,000 outputs. Under 20 outputs made the cut. What we learned is that there's a lot of evidence about the role of clinical interventions in communities, but there is not a lot of evidence about the role of community resources, non-clinical resources like open access youth services, community gyms. The evidence that does exist is fairly low quality, but it's relatively promising. It suggests that these kinds of spaces can play a really important role in children and young people's lives, and that seems to be to do with the combination of tailored resources, of culturally competent staff, which can create safe and inclusive environments which enable relationships of trust, hopefully for the long term, where conversations about well-being, about emotions, can be destigmatised and normalised between young people as peers and between young people and adults. So what we've done in Sheffield is zoomed in on one community project called Unity Gym. It's a project that Ozzy's been involved with for a very long time, and I'm going to hand over to you to say a bit about the gym.
Thank you. So, Unity Gym project, I've been involved for a good part of the last 15 years. I came through as a participant and progressed through the pathways as a volunteer, and now I'm a strength and conditioning coach at the gym that I first started bench pressing. So, Unity Gym project, what is it? It's a community organisation based in a local area in Sheffield, an urban area. We provide opportunities for training. We promote healthy lifestyle and in particular strength training. And that's what Unity Gym project is.
So the impetus for this bid originally came from conversations that we'd already been having in and around the gym. It's a community project that I've been involved with for about 10 years. And actually from some quite tragic sort of foundations where there'd been, 2 or 3 deaths within the community. We knew that the young people who access our services were dealing with trauma, were dealing with the kind of aftermath of these losses. And we didn't really know where to start in terms of talking about mental health. So it was conversations with young people in the car park outside the gym, which gave us the idea originally to think about whether or not we could use research as a kind of mechanism for resourcing some of that work and opening up some of these conversations. So we've been having conversations with local people in the gym between the age of 15 and 30 from minoritised backgrounds about a whole range of different topics. We've been asking them questions about masculinity, about hopes for the future, about what it means to live a good life, about why it's important to access community resources and what it is that community resources offer, and about the relationship between mental health, well-being, the mind, and the body. So we're limited on time. We've got lots to say, and we're really happy to go into more detail over questions. But what we're going to do is just give you a quick overview of some headlines before then telling you about the next steps for the project. I might have run out. Oh, there we go.
So, when conducting these interviews and focus groups, we found a sense of ambivalence around, especially when we were talking about mental health. Some of the members expressed that the importance of mental health among men, they advocated for men to talk to each other, to normalise conversations around mental health. However, when asked about their lives in particular, if they was experiencing mental health, would they reach out? We found the response to be that they was less inclined to reach out or to have them conversations. They would rather just go at it alone. So yeah, we also spoke about transitioning into adulthood and the difficulties facing that these young people face around the education system, the labour market, and the criminal justice system. And there's a quote here, I won't go through it, but it's just, it kind of emphasises on the weight that these young people have on their shoulders just on a day-to-day basis. And yeah, so that's what that covers.
It was a really interesting tension in the conversations because on the one hand, people would say, yeah, mental health is really important. We learn about this at college. Then we say, so do you talk to each other? And they say, no. That's really awkward. We don't want to do that. So this ambivalence kind of ran through all of the conversations. It made it a really complicated discussion to have. We did find that talking about the body first was a really, really useful way in. The people that we spoke to were much more confident talking about why they were training in the gym. And then that link between the mind and the body was a sort of acceptable conversation, which allowed us to get into some more details about emotion. But we learned a lot through that about why it's important to have spaces where young men can get together and to practice things, whether it's weightlifting, football, men's sheds movements, or whatever else. So what was reported to us about the gym? First, we heard that young people, and particularly people from minoritised backgrounds who might feel misrepresented or misunderstood in more formal or clinical settings, were not comfortable sharing their personal information with GPs, for example, said to us that they wouldn't reach out to a mental health professional if they were feeling unwell, and they might not also reach out to their peers, even though they're all agreeing that this is an important thing to do. What they did say was that they would come to the gym because it's a trusted space, or they would go to the mosque. So trusted community resources that are embedded and local were described as really vital spaces for young people to practice sort of implicit care and to be together and to share energy. And over time, that might enable some more on-the-nose and explicit conversations about how people are feeling. But critically, what it allowed the volunteers to do is notice how young people were presenting and start to kind of broach those conversations gently. Young people also told us a lot about the importance of structure and accomplishment that they derived from accessing spaces like Unity Gym. So going to the gym gave people who were looking for jobs, out of education and out of employment, a reason to get out of bed, a reason to build structure and routine into their lives, an opportunity to gain a sense of personal accomplishment in a setting where that was actually very, very difficult to access. We heard about the wider benefits of improved confidence, of self-esteem, but also social capital and networks from engaging with an intergenerational space. People picked up connections in the gym. Sometimes they led to jobs or apprenticeships and these kinds of more concrete and tangible opportunities, which were really important to the young people that we were talking about and sort of central to the social determinants of mental health that were creating stress in people's everyday lives. So we've been trying to rack our brains to make sense of how we describe this, because there's a really complicated range of things going on. And GEJ's actually helped us to think about health creation as a potentially more apt framework for understanding what these sorts of resources offer beyond prevention. So when we talk to our users about whether the gym's a site of mental health prevention, there was a real reticence to even make the connection, I think, between mental health and the gym itself. The gym is not there, and these sorts of resources do not just exist to prevent mental health. They present an opportunity for people to build health, to maintain health. And health creation offers a definition, and this is Nigel Crisp, who's the former chief exec of the NHS, which is the process through which individuals and communities gain a sense of purpose, hope, mastery, and control over their own lives and immediate environments. And when this happens, health and well-being is enhanced. And I think this was much closer, wasn't it, Ozzy, to the way that we were reading the data and what kind of captures what it is that young people were saying about the benefits of these sorts of resources. So we think health creation is a cool way of understanding the kind of vital importance of these resources within communities. So we're just going to very briefly tell you about what's happening next, and then we'll move on to questions. So we've been proactively trying to share this with people, and one of the spaces where this has had some really unexpected purchase is with the team who are responsible for children and young people's mental health transformation in North Yorkshire. So we presented our findings, myself, Ozzy, Saeed, who's the founder of the gym, to their team at the end of December. And within the next 3 weeks, they'd sent us an implementation plan. And what they want to do, which was a big surprise to us, but a really nice surprise, is pilot the implementation of Unity Gym project principles across their gyms in the North Yorkshire Local Authority. So they want to pilot this in community gyms, in council-run gyms, and commercial gyms. So we're collaborating right now on a funding application to the mayoral combined authority to get that work supported, and then we'll be seeking match funding to try and evaluate that work so we can assess whether or not this works in different contexts, but also, you know, whether we could scale that potentially further. And really what this is about is just playing around with the embedding of youth work principles into activity, physical activity spaces, integrating youth work into gym spaces. So we've co-produced a set of principles. We don't have time to explore them now, but it would be a good question to ask if anybody wants an idea. We can go through them. We've got them printed out here. And what we're going to be doing is just seeing whether we can implement these in different contexts, in different settings in North Yorkshire, and then assessing whether or not that achieves similar successes to the stories that we're hearing from young people in Sheffield.
And I'd just like to add that the idea here is not to just replicate what goes on in Unity Gym, because I think we can both agree that's, you know, it's not really possible. But to just apply these principles and just see what happens, and hopefully we can make a difference in some way.
Yeah, a couple of examples just to make that concrete, because we have got 1 minute and 46 seconds, is providing subsidised access to young people in the gym, or creating volunteering opportunities within gyms so local users can upskill and volunteer and then move on to sessional paid work. And these are all the kinds of things that we've sort of taken for granted as part of the charity that we're connected with. But working with the transformation team in North Yorkshire has really prompted us to just write them down and tell the story a little bit more coherently. And then we're sort of exploring how we can move forward from that point. So thanks for your attention. It's really cool to be presenting at the British Library alongside such amazing speakers. Cheers.
Thank you for sticking to time. And we have got another minute left, but I think we have a few minutes for questions, so for either of the teams. And I'm just going to check, because we might have some online. Sorry, do that as well. Whilst, if there's anybody in the audience who's going to start us off, please go ahead.
Hi, thanks very much. Yeah, I'm from Sheffield. I actually asked a question earlier, so sorry. Helen Hoyle. I'm interested in the Unity Gym project, very much so. You're looking at males and men's mental health. I'm just wondering, you know, rolling this out across young people in North Yorkshire and more widely, are there women, are there young females that are using gyms? If not at Unity Gym, you said the principles could be rolled out, but in a sort of different contextual way. Will this be relevant to people, females and people across genders in these different environments? Thank you.
Thanks, Helen, for the question. Yeah, I certainly hope so. I mean, the Unity Gym isn't an exclusively male space. It's an inclusive place, but it is disproportionately accessed by young men from the local community. And obviously the focus of the study, which is about young men's mental health, sort of dictated to a degree, you know, the emphasis, the gendered emphasis of what it is that we're talking about. Although our other case study, which is in the Northeast, is in a mixed gendered space. The findings are very similar in terms of what it is that young people said were important. So because the principles are at that slightly higher level of, you know, accessibility, creating a low demand resource that people can engage with in their own time and, you know, on their own terms, the embedding of youth work principles, we would really hope that they would be very widely applicable and kind of inclusive in terms of their impacts. So yeah, what we're certainly not doing is saying that we're interested in trying to develop better resources that are just for men. we would like to see community resources, supporting everybody and anybody who needs support.
I'm going to follow up with one more on that. There's lots of questions on the principles, but one to follow up nicely is about how you're using them, and will the settings be able to interpret them within their own context? Is it such that, a youth club or a school or somewhere else can use it differently?
Yes. So, the first thing is we haven't got quite that far yet. But what we're planning for June, late June in North Yorkshire is a launch event. Active North Yorkshire and North Yorkshire Sport are two partners that are involved in that. And everybody and anybody who's in North Yorkshire and who's involved in youth work provision, but also in gym spaces, will be invited to that event. And we're going to launch the principles and sort of work together, hopefully, with the interested parties in thinking about how they could be implemented and the sort of relevance and appropriateness of them for the space. But we hope that they're at a high enough level of kind of abstraction to be the kinds of principles that could be implemented. And as Ozzy said, this is not about replicating the kind of exact community resource. It's about just offering a way of thinking slightly differently about what gym spaces can offer in terms of the embedding of youth work principles and practices.
Yeah, just to add to that, I feel like most community organisations will have their own people that they need to cater to. So there's the principles are not there to be like strict guidelines. It's there to just help guide you and like what your community's needs are. So you can just play with the nuances a little bit and tailor it to whoever you're trying to, like your target audience.
Thank you. I'm going to start us off with one for Abby, and then there's a question up there. So, Abby, how did you decide which Delphi statements could be lost or combined to condense into your principles?
Yeah, so we had, like I said, 82 statements that met our rules for consensus. So in our Delphi study, we had 3 different panels. So we had education and youth organisation staff, we had professionals who work with young people in other contexts, and we had academics and clinical experts. So for a statement to be included, all 3 panels had to reach consensus. So that was 70% rating that statement as being very important. We did have a lot more than that, although quite a lot did go through. But there was a lot of overlap because we took the initial statements from the interview data, but also from our work with our different advisory groups. So we kind of went through an iterative process where we clustered them under headings. Emily did a lot of work on this, trying to group them, and then we met together as a team to have a writing day where we kind of split into different topics and worked our way through that long document to try and condense them down into the overarching principles. So for us, it was really important not to be really prescriptive and say, your policy should say this, because that advice might change over time or new evidence might come out. Instead, it was make sure that your policy considers this topic area. And during that day, we were often moving statements around into the things that other groups were working with and using lots of different colour coding. So we're at a point now where we've got a version that we're fairly happy with, kind of covers everything that came through in the Delphi study, but we're not finished yet because it has to go back to all of our advisory groups to make sure that it is true to young people and adult experiences and needs as well. So,
thank you. I think I saw a hand up there. Sorry, yeah, please, go ahead.
Oh, it's all right. Hi, I'm John Hume from People's Health Trust, and thank you. They were all really great presentations. I really appreciated them, and I've been following Unity Gym as well, so I've loved what you've been doing, and we're a partner with the DHSC Men's Health Strategy, so I'd love to talk to you about implementing it, so we can talk about that afterwards. But I really thought both of you talked about trusted spaces and the importance of that at a community level, which we totally agree with. That's all of our work, and I absolutely agree. But one of the things that really stood out for me was that as part of that, there was also, you talked about some of the avoidance by colleges, for example, and that happens a lot in places of an avoidance of this because of fear, shame, stigma about mental health. So I wondered if there was work for all of you in thinking about the trusted leaders within those spaces and their ability to have those conversations, the capacity building that needs to happen in that as well, because it's actually therapeutic work as well, and it's quite tricky to do and quite difficult to hold, and a lot of those people are carrying their own intergenerational shame, etc. So I just wondered if you'd done any work on that.
that's a big question. Do you want to go?
Sorry.
Yeah. So I think it's really difficult with the topic around self-harm and suicide because of the really severe potential consequences if an organisation gets it wrong and they feel that they failed a young person. And most of the people we talked to were those kind of leaders within school settings, but we think it's really important as well to talk to teachers and staff on the ground who might have that role within their peer group where they're looked to and respected. But sometimes that's constrained by the structures where the school leadership will only send certain staff on training based on their groups. So I think by really pushing that all staff should have access to training and be able to opt into it if that's what they want for their career development and to support their peers, that's a really important message. I think also part of the complexity is that there isn't particularly robust evidence about how safe it really is to talk to young people about self-harm and suicide. So to be reassuring, we need better evidence in that area, and that's something we're going to have to do next. Did you want to say anything about that? No? Okay.
Yeah, thanks for your question. And I think at the start of our presentation, I mentioned depletion in the voluntary and community sector. And part of what I'm thinking there when I say that is that, you know, the people that we've worked with through these case studies are carrying a lot of weight. They are doing a lot of work in very precarious conditions with very low pay, and they're engaging with people on highly sensitive topics, and often in a very responsive way, which can mean needing to attend to people's needs in the middle of the night or certainly outside of working hours. So I think the point you raise about the needs of the health creators, to use the health creation language, is really, really important and is something that's critical for us to hold on to as we have this kind of big narrative shift in favour of community resources. That needs to be matched with the resource inflows that sustain the sort of care work that we know is so important. There's been several reports recently about by and for organisations, which demonstrates that these are the organisations that tend to be, the least resourced, even though they're often the organisations who have the most meaningful relationships with communities. But I know, Ozzy, you've been involved with Temi Mwale and Patrick Williams' initiative recently on the Harm to Healing Coalition, and that strikes me as a really good example of an initiative that's trying to address some of these concerns. So I wonder if you could just say a bit about that.
Yeah, of course. Yeah, the initiative is a coalition of by and for community organisations, and the aim is to build systems away from current systems that don't prioritise healing, and instead they harm us. So the criminal justice system, the mental health system. So yeah, I've been part of the Harm to Healing Coalition as a Unity Gym member, and yeah, you mentioned something around trusted adults, which is a key thing in Unity Gym. And it just happened naturally, I'm Somali ethnicity, within the community, we have trusted adults where, me as a young lad growing up, if I was, spotted by one of the aunties doing something mischievous, I'd get dragged home by my ear.
That never happened.
Yeah, no, it never happened. But, yeah, so that whole notion of trusted adults and just being there for each other, I recall Jack said right at the beginning, feeling held. That's something that we embody as a community, and it just happened naturally. But I feel like if we can put in place some sort of training, I don't know how, but yeah.
Thank you so much. I'm going to stop us there if that's okay. Apologies, because we are out of time. But there is one question for Usman, and I will ask that because I don't think you've had the opportunity to speak. Very simple question. Someone's interested to know, has your experience of being as part of the 4S study inspired you to think about training or a career in public health?
I was going to say my work in this has definitely inspired me to go into mental health. I am trained in being a young people's mental health counsellor, and that's due to this work and due to what I've experienced here, having that opportunity to see that I can create change, and going into environments where young people are in the same shoes that I was. But I haven't necessarily thought of public health as a route, but
now you'll
maybe I will.
There you go. Thank you very much to all four of you, and excellent presentations. Really enjoyed it. I'm going to move us on swiftly, sorry, apologies, because we want to make sure we have our break. So we're going on to our digital stories. We have 4 stories which we will watch, and after that we'll invite, if we have time, invite our storytellers to answer some questions. So we have Lizzy Winstone, Ciara Thomas, Andy Mahon and Libby Haynes, and we'll get those started. Do I need to press something? Yeah, apologies. Yeah.
The Mind Your Feed website was created for our ResNet project to help teachers, schools and young people understand how social media algorithms can shape mental health and well-being and what we can do about it. The story it tells is grounded in research, framed here through a young person's everyday experience. Every day I open social media, and every day my feed looks a little different from everyone else's. What I see isn't random. It's shaped by algorithms, systems that are designed to predict what will keep me scrolling, clicking and coming back. Sometimes that can feel positive. I see humour, creativity, people like me, communities that understand me, videos that make me laugh when I'm having a bad day. But that's not the whole story. I also see pressure, perfect bodies, distressing news, arguments, shopping I never asked for, posts that catch me at the wrong moment and make everything feel worse. Seeing the same kinds of content again and again can shape how I feel, what I think is normal and how I see myself, because every pause, click, like or comment teaches the platform what to show me next, even if I was watching out of curiosity, shock, concern or disgust. Many young people do learn ways to manage this. We use not interested, we block accounts, we scroll away, we take breaks. But individual strategies can only do so much inside systems that are built to capture our attention. Social media is now part of the environment where mental health is shaped, just like school, family or the neighbourhoods we grow up in. Platforms need safer settings by default, more transparency and stronger limits on algorithmic systems that amplify harm. But while policy and industry catch up, schools can help young people think critically about what they see, understand how algorithms influence them and learn strategies that protect their well-being. That's why we created this website, a practical resource to support those conversations. Because while systems change can take time, schools can help young people navigate the digital world more safely today.
I think that we put so much pressure on ourselves to be perfect, but that causes a lot of anxiety because you're constantly thinking about it. You're worried about every minuscule thing that you do or say.
Why are girls experiencing such high levels of anxiety? By the age of 18, girls were more than twice as likely to experience mental health problems such as anxiety and depression compared to boys, and this gender gap appears to be widening. My name is Ciara Thomas. I'm a PhD student at the University of Bristol, and I've been asking girls for their views on what causes anxiety and how they can be better supported. These interviews covered a vast range of topics, such as strict beauty standards and gender norms, academic pressure, planning for the future, valuable but complicated friendships, social media and misogyny. Here are some of the things the girls have said.
Every day I try to wake up 2 hours earlier than my normal schedule to go to college just so I can do my hair, my makeup. It's a trauma. It's really bad. Some days you just don't want to go because you don't want to do all of that.
I'm constantly scrolling and thinking, oh, I should look like her, you know, and that makes me anxious going to college.
I remember boys were making disgusting comments about my body in a sexual way, and I just felt horrible. I just wanted to go home. It made me feel gross and overthink, like, oh, is my outfit too revealing? Am I disgusting?
The boys at school mention Andrew Tate and they'll say, I don't get why people don't like him. All he did was talk about beating up a woman and she deserved that. I wish I could pull as many girls as him. And they look up to him and it sort of scares me. What if they end up getting girlfriends and wives and daughters?
Girls are suffering, and we need to meaningfully understand their experiences in order to develop tailored interventions and improve support. Thank you for listening.
The mental health of young people is a growing public health concern. In recent years, rates of mental health difficulties have been increasing, with about 1 in 5 16 to 25-year-olds in England experiencing a mental health condition. This age is a critical period of development and a time in which young people face considerable challenges, such as uncertainty about the future, worries about work, money, education, and identity. Many young people in this age group attend further education colleges, yet further education is an often overlooked setting in both research and policy. Importantly, further education colleges support a diverse and often vulnerable student population, but they face real challenges, and one of the biggest challenges they are facing is the growing problem of their students' mental health. While current approaches struggle to deal with the demand for support, we need alternative options that are accessible, preventative, and effective in college settings. One such option is physical activity. While we know physical activity is good for our mental health and well-being, many older adolescents in England aren't getting sufficient amounts to achieve these benefits. This is where my research comes in. My PhD explores how physical activity could be used to support the mental health of further education students. By bringing together existing evidence, the insights of college staff and the voices of college students themselves through 3 interlinked studies, my research aims to answer a simple question. How could physical activity be used to support the mental health and well-being of college students in practical and functional ways in the future? By answering this question, my research aims to identify approaches that are effective, acceptable, and meaningful for the students they're intended to support, and to generate evidence that can inform future interventions and policy in this area.
Young adults are having a hard time. There are lots of problems piling up on them in this world of climate, financial and geopolitical insecurity. A record number of young adults are unable to work due to poor mental health, and this can lead to them being caught in the trap of being NEET. That is, not in education, employment or training. Being NEET worsens mental health, so the longer they are stuck there, the harder it is to escape. NEET people can expect to have worse physical health and a shorter life expectancy too. Thankfully, there is lots of great research happening into how to help people to escape the trap of being NEET. But what I'm interested in is working out what can be done by policymakers and employers to stop people falling into this trap in the first place. Specifically, I want to know what it is about a workplace that affects the mental health of young adults, so that these environments can be improved and reduce their chances of being unable to stay employed due to poor mental health. So far, I found some potential big issues include job insecurity and hostility in the workplace. Next, I'm planning to see if I can find any other relevant workplace features hidden in a large data set, and then I want to bring all this to some actual young adults so they can help me make sense of it. I really believe young adults deserve to thrive in their workplaces, but even if people aren't bothered about that, they can't deny that reducing sickness absence and turnover costs is good for employers, and having more people in the community being happy, healthy and reaching their potential is good for all of us. Let's build up young adults instead of breaking them down.
What fantastic videos. Those were really great. So can I ask the 4 people who did those to stand up for us? I think they're all here. Oh, they're here right in the front. Lovely. I'm just trying to work out if we've got, I can't see the timer. Are we okay to do some questions? So please come up to the stage, and we've got a few minutes to ask questions. I'm sure there'll be more than we can answer, and you can grab them afterwards in the break. So anybody want to start off with one? Oh, I don't know if there's anyone here. Let me see. Who's going to go? Okay, we have our first one there. Mark.
Hi, Lizzy. Thank you for the presentation. What are your next steps? Easy question, yeah?
Hi. The next steps, so we have 2 papers from our ResNet study that are currently under review. The website is kind of almost ready to be launched, but we're currently trying to develop some sort of teachers have said to us that what they really want is basically a PowerPoint presentation that they can walk through. So that's what we're working on at the moment. Yeah.
great.
Hi, I'm Katie from the University of Sheffield. There was some great storytelling, and I just wondered if anybody wanted to comment on the approach to putting together a creative story, just how you did it.
I'm sure you can all contribute. Go ahead.
I mean, I suppose the main, driver for my story is that my kids like Lego too much. And if I was able to somehow integrate that into something vaguely professional, then that would excuse all the Lego they have got. So that was my main inspiration, and went from there, really.
Anybody else want to comment on their approach? Please.
I found it quite challenging. I think it's quite difficult if you're not naturally artistically inclined. So I'm always really kind of blown away when people use really innovative kind of artistic approaches to things. But yeah, I think we should all have some sort of creative training maybe.
They were all excellent. Any other thoughts or questions for our four presenters?
Hi, thank you very much. They were great. Just to follow up on that last question, do you think that that probably had more impact than you doing a straightforward, this is my research and this is what matters? Doing it that way? Maybe you should be asking the audience, all of you.
Anyone? Go on, Andy.
I mean, I think it's an interesting challenge, and I think it's probably nicer at times to come up or to do that rather than come up and just talk at people for a little bit. Makes you think slightly differently about it as well in terms of getting at the heart of the story of your research, which I don't think we get the opportunity to talk about enough. So, yeah, I think that's one of the interesting parts of doing a story like that.
I think I'd just like to add that I do think an important part of public health, especially public mental health, is meeting people where they are. And for the moment, for young adults, young people, actually short form videos is how to meet them there. So I think it's useful to be able to have a go at that and see how that can be used.
Great responses. Is there? Sorry, I think is somebody, am I just imagining it? No, I thought I saw a hand up there. Probably just people fanning themselves. Any other? I don't see any hands up, and I don't think we've got have we got any on Slido? Shall I double check? But I think that we're going to have more of those digital stories, and it was a fantastic way of communicating your research, and I think we learnt a lot from them. So if we haven't got any more questions, I think we could break take our break. Is that where we're at? Or there isn't anything on Slido, I haven't missed it. No, okay. So, thank you. So thank you again to our four presenters.